It also aligns with our system goals. So we know that this is an important part of value-based care, so improved patient outcomes being tied to reimbursement as opposed to purely a fee-for-service model that is just looking at the number of patients that are being seen. We've heard a few times today how important that time is with patients. And then also looking at diversity and inclusion as well as incorporating integrative health. So why is this important now? Well, I think I'm kind of preaching to the choir with this, which is that conventional care may be excellent for acute care, but it's really not meeting our needs in terms of chronic care and prevention. So how can we kind of do things differently? And this graph looks at the impact of different domains on premature death. So if you look at that big segment, 40% is due to individual behavior, which is also lifestyles, social and environmental factors as well at 20%. That is a huge portion of that overall circle. And in the current model of care, again, predominantly in individual care, we're just not moving the needle in those areas. So if we want better health, we really have to find out a way to have an influence over those factors. And group visits is just an excellent way to be able to do that. So for a variety of different reasons, it's an integrative model by design. So some of the features here, we're very intentional about the space that we create. So bringing patients together in a circle. It's a non-hierarchical space. The providers and the patients are all equally participating in the groups and learning from the experience. There's that longitudinal relationship, so you have the chance to develop trust, some mutual support in the journey. Also, the longer contact time between providers and patients. So as opposed to having maybe 15 minutes, you have more like 2 hours of time with the patients and the providers. The peer learning and support, that's something that is totally left on the table in individual care. There's a lot of expertise that we all have in our own lived experience, especially people who are experiencing a chronic condition, that can be used as a strength to share with others, right, to help them who may be at a different point in their journey. We do some mind-body practice and goal setting at every visit. We bring some other types of integrative specialists in, so you may have a chance to meet a new type of provider, experience a new modality, something that, as an individual, you might not choose to seek out on your own, but if it's included in the group, then it may be something that you're willing to try. We've seen a lot of uptake, for example, in acupuncture, where a group of patients, I'm trying that, but once one person goes, then everyone else does. So our chronic conditions program at UC Health, we run basic and advanced groups for chronic pain, weight management, diabetes, and these meet once a month for 4 months. And for our basic curriculum, we focus on this Pillars of Health model. So you can see these listed here. And just to give you an example, for each of these, we would have one session that's really dedicated to diving into that. So think about anti-inflammatory diet. We learned from our patients that using the old ways, Mediterranean diet was a format that worked well for them in terms of fitting to their food culture, but also kind of meeting our standards for a healthy anti-inflammatory diet. So we do a lot of activities related to that. So for example, we might ask you, what did you have for dinner tonight, and where does that fall, on the diet pyramid? We might say, okay, here are a group of foods. Let's line them up according to their carb content, for example, in a group with diabetes. Or we might do something like using food models to develop a healthy plate, and then share it with, other patients in the group to see what, you've come up with versus them, and to get some ideas for things you might try that night. Our chronic conditions advanced curriculum, has a similar kind of format once a month for 4 months. Patients who have graduated from the basic curriculum can sign up for this advanced curriculum and make a commitment for 4 months at a time. This continues to focus on lifestyle, but it also expands a little bit into the area of social and environmental factors. One of the growth areas for us this year is really focusing on those community connections, because we know that most of health does not happen inside the walls of the clinic or the hospital, but out in people's communities and in their homes. So how can we help to bridge that gap, introduce patients to resources in their own neighborhoods that they may not yet be familiar with, that they can then continue to work with as a part of their health journey, even separate from us. So one example of that that I just like to call out, we have a new dynamic member of our team in centering. Her name is Diva Jonathan. She is a nurse practitioner within the Division of Endocrinology, and she has piloted this connection with La Soup. I don't know how many of you may have heard of La Soup, but it's an organization where they reclaim food from restaurants or grocery stores that would otherwise go to waste, and instead they repurpose that to provide meals for food insecure families. And they also teach cooking in the process. And so she connected us with La Soup, and we had this month our first virtual teaching kitchen with La Soup, and then next month we'll be trying it in person with our centering group. So these pictures here are actually me cooking at home in my own kitchen when we were doing virtual groups while the patients were cooking the same recipe in their homes. I'm not a chef, so this was like, kind of a growth experience for me. I'm glad that we're having an actual chef on board now, and again, the La Soup experience I think is super exciting. We also did a field trip for the first time a couple of weeks ago to do yoga in a local park with one of our centering groups. So these are the kind of things that we are hoping to do more and more of in the next year. So just to give you a little bit of an idea of what our groups might look like, I'm going to turn things over to Jinda to be able to take us through some table activities.
Awesome, thank you, and thanks Tiffany for such a great overview. In true centering fashion, we are going to actually experience just a little taste of centering, and so if you guys over there on the side want to come in and join one of these tables here, just kind of slide one of your chairs in here. I'm going to kind of sit right here with you guys here. That's all right? Dr. Cott, oh, you're perfect. Great, thank you. You'll stay? Okay, very good. In centering fashion, we'll not force anyone to do things they feel uncomfortable with either. So we'll just go ahead and just keeping in mind in a centering visit, you would have already have had a one-on-one with your medical provider. You would have addressed things that are pertinent to you that you don't want to share in the group visit, just a quick one-on-one so that your individual needs are also being taken care of, right? And then we're going to gather together. Welcome, everyone. Thank you for joining us today for our group visit. We're just going to start off with a common exercise. We've heard so much about the breath today, and it's called 3 breaths. And so I invite you to sit in a comfortable position. I like to put my feet flat on the floor. I like to sit with my sit bones kind of pushing into the chair. I like to pretend like my head is being suspended by a string, and my spine is just kind of dangling, so it's nice and relaxed. And I invite you all to take a deep breath in through your nose with me, and exhale through your mouth fully. And as you exhale, I invite you to imagine letting go of all the stresses of the day up to this point, all the worries and frustrations you've had, if you were running late or you had some difficult conversations. Just let it go. Let it go. And then together, as we breathe in through our nose again, and exhale through your mouth fully, I invite you to imagine letting go of everything that's to come after this. The things that you may have to do, the groceries you need to buy, just let them go. Just let everything go. And with our last group inhale, in through the nose, and exhale through the mouth, I invite you to focus on the moment right now, the time that we're going to spend here together, focusing in on the here and now. And when you're ready, feel free to open your eyes if you have them closed, or if they're already open, hello. And so we're going to, some of us don't know each other here, so in our individual circles, if you haven't cleaned your hands with one of these little hand sanitizers, I invite you to do a little squirt. Oops, and sorry, I may have put more than a little squirt in your hand there. So feel free to squirt and just pass it on around because we're going to have a little introduction activity. You should see a ball somewhere on that table, and it may be fuzzy. It may look like a sea anemone. And so if anyone wants to pick up that ball, and if no one does, okay, great, thank you, awesome. Whoever has the ball, just share your name and one thing that you're grateful for today, or actually this week. We'll spread it to the week. One thing that you're grateful this week, share your name, and then throw the ball to someone else on the table. Or if you don't feel like throwing it, you can just kind of pass it or roll it along the side. And we'll just, when I hear everyone kind of quieting down, we'll come back together.
I'm Amanda. I'm grateful that our architect finally leveled our very big floor.
Technical impossibility.
Had all of her senior class kind of run through this long, line of parents who were cheering.
I'm Jennifer, and
I had a daughter that graduated in 2020 and didn't get to do any of that, so I was really
Seen for 33 years and had no idea. So I'm very excited.
I'm Peter, and I'm very grateful for starting a new challenge for myself.
I feel at home. I'm grateful for that. Every time I do spend some time with my husband, particularly this morning, I'm going to find some flowers in my house.
Oh, nice.
Sean,
I'm grateful for this incredible community here today. We've been playing this for years. So just the community and everyone else.
Especially after she's here. I'm Dave. I'm grateful. Just want to pray for you. Thank you.
hi, I'm Lisa. I'm grateful for weather in the lower life obligations this week, and I'm grateful. Hi, I'm Sonia, and I'm truly grateful for you see that we're doing this today. Hi, I'm Carrie. Together and really bridging all these different modalities together in one space. I'm just grateful for more keep happening. It's really exciting. Thank you.
I'm Jada, and I'm grateful for all of you because it's things that are important to and it really lightens my heart. So thankful for the opportunity, and also really looking forward to being able to share yourself here. I'm kidding. So where they're at and just kind of chit chat. So we're in North.
Yeah.
All right, that's exciting. And then what kind of
college. Yeah, she's got its own space sort of through our just a straight up.
I love that. I had a book growing up too.
Sounds like things are quieting down over there, so fabulous. How did that feel to everyone? Good, yeah, so it's a easy thing to do to get to know one another. And so I'm going to just, we're going to engage in an activity that kind of looks at our health. And so you should see in front of you, there's some papers. Feel free to grab one and pass it around. Also some crayons and markers. And what we're going to do for the next few minutes is imagine what health looks like to you. And think about what represents health to you. And we're going to take a few minutes to just scribble something down, draw something, creatively express whatever health looks like to you in the next few minutes. I'm going to hit the bell after a few minutes, so we'll play some music. I'll hit the bell after a few minutes. When I hit the bell, that'll be a signal for us to turn to someone either on your right or your left and share what you've started on. If you weren't able to finish, what you were thinking, and so kind of share with the person next to you. Are these instructions clear? Any questions? So imagine what health looks like to you. All right, any other questions? No? All right, enjoy.
Once again, Aretha Franklin, please. Aretha Franklin.
There's 4 people. There are 5 people.
So if you have not yet already started sharing with people next to you, feel free to start doing that now, and I'll ring the bell once we need to move on to our next activity.
Wait, we didn't have time to share.
We're taking time to share now.
Okay.
I'll play some music as well.
I wouldn't be interested in sharing our.
I don't So right here, there are trees, and it looks like it's raining. And like, I just, I don't want people to have to kind of characterize it like I think that that's how we all kind of feed each other, because actually we have a positive
I've been doing a lot of hard
so
stuff.
it's kind of like an
So everything, all the colors,
so that's this, and then of course
Oh, nice.
Wow, where do you
Find balance, what is beyond feedback? I was trying to balance
I want it too high. Oh, yeah.
About relaxing with like working out or tasks. And then taking care of that house with fun. Being more intentional and taking time or focusing on work that we grow.
Mine is
So it's not entirely making sure health.
I guess you can see it soon. Maybe vegetables would be healthier, but I really love coffee. And when I feel kind of drinking coffee versus no matter what I don't feel like it. So like I kind of like when I'm sharing coffee with friends.
I also think the average person like that.
Yeah.
Oh, you know, it could be that. It could be tea. I do like a good cup of Earl Grey. What's your drug?
I just sort of like, I kind of like more artistic expression. It was like there was like the right and it's like more artistic with the bell and the music symbol, but it also kind of needs with it, but it's not
Right.
to be like century, sunshine.
Ooh, that's so great. Wow. Yeah. That's awesome.
eating enough, drinking enough water, which is literally never what we try. We try our best. When I spend time with people I love, it's been nice to have the sunshine together.
Solidarity.
It's a lot better. The weather is nice. Motivation to do things. Feel.
I'm so glad you incorporated it.
There's just one thing, we never ever do nothing.
Pamela? It looks pretty good. I can tell there's already a bike. So that's great. That's better than what I could do. Yeah.
I also like plant mom, so we have journal every we have to do. I like to journal on the office whatsoever. So going back to it during the summer, I'm really excited about it. I also have a product collection.
You're an artist, aren't you?
The like throwback. Yeah, I'm many things that you guys all said. So also, being outdoors, being in nature, loving the world. So sort of my family, my husband, my two daughters, us being together, doing movement, meditation, our hearts light, and sort of energy from us to the world, and then healthy food that we can share together, and also like I said, essential has just been so amazing.
Because we all know each other and like we do a positive.
I know, I'm noticing just the everyone pretty much commented about that, and also about
So it's kind of like
having themes of nature, and that, like some connections, but also like self-time, and you mentioned also like some more than individual time as well as the communal time.
my relationship with them.
Just the ability to be connected with others. I think we realize what a gift it is, especially after not that we're out there.
I just realized how much sugar you're in as well. Like, appreciate it.
Balance of community.
It's great. I craved it. I sought it out.
They sound like a would you like to share yours?
I like both.
Isn't it great?
Well, I hope that we had some good sharing. It sounds like we did. We're going to move into our last activity before we talk about outcomes, because while I'm hearing a lot of laughing, so hopefully you're having fun with this and maybe learning even a little bit more about pain management or what health means to other people, and maybe those ideas are resonating in yourself, so learning a little bit more about ourselves. There's actually even health outcomes that come from engaging in these activities. So it's fun and beneficial, so it's fabulous all around. So our keynote speaker actually helped start this next activity for me. So in the middle of the table, there's some worksheets, and he mentioned something about SMART goals. And so now we all know what SMART goals are, and we all had a moment to even contemplate a little bit about one SMART goal that we want to maybe work on over the next week or next month. Maybe it was something that came to mind, or maybe you're just kind of trying to figure out what to do. So this next activity just gives us a few minutes to kind of work through that and have it actually written down so we can leave here with an action item in place. And then as far as follow-up goes, I didn't even know about the optimize@uc.edu. Is that the right email?
That's what, yeah.
Optimize@uc.edu. So as far as follow-up, we can actually have an email that you can follow up with our SMART goals as well. So if you want to take one of these guys, and I'll just take one, pass it around. We'll take a few minutes to create our SMART goal, and then we'll go ahead and share that and end our presentation. So to complete the worksheet, it's a worksheet that helps you identify the specific thing that you'd like to do, and you can write something in there just to help formulate the complete SMART goal at the bottom. So one specific goal, and you can ask, is it clear? It's just a check, and then how are you going to measure that goal? And you would put that into the next box. Just to verify that the goal is challenging but not impossible, to make it attainable, and that will be in the third box, just a check to yourself. And a check below that, is the goal functional and necessary? And then a time frame in which you want to complete that goal will be the last one.
I know I'm doing it right now, so maybe by the end I might be able to Yes. That's right.
Don't come easy, but I keep on waiting. I'm just waiting for that solid voice talking at night, or something that comes to hold me tight. I keep waiting, keep on giving thanks, but it ain't easy. It ain't easy. When mama said we can't hurry it up,
We don't want to miss that.
she said, just give it time, no matter
Yes.
how long it takes.
I know, isn't that crazy? We have so much fun. What was the
If you have not yet started sharing, feel free to share your goal with someone next to you.
I'm sure that it was still amazing. You know, like that's so cool.
And then I put it on the blog all day, actually, I need to get done on the website. The website is number one.
Too much energy. You just get it all out there.
All right, guys, I'm so sorry to have to cut this short here. So because our time is short and we definitely don't want to miss the drum circle, I wanted to just kind of lead us in a closing activity really quick. And so at the end of all of our groups, we tend to have some closing activity, whether it's a meditation or a poem, a listening activity. And so this one is going to be just a repeat after me quote. All right, so feel free, and if you don't want to repeat after me, that's fine also, but I'll try to keep it in like phrases. So it's an African proverb. If you want to go fast, go alone. If you want to go far, go together. And we'll do it one more time. If you want to go fast, go alone. If you want to go far, go together. Awesome. All right. And yes, both groups end with applause and hugs. It just happens that way. And so I'd like to introduce Dr. Golubich. He's going to close us out here.
And as Lon is taking the stage, I just wanted to quickly say that if you are willing to share if you want to take your drawings home to use for your own personal reflections, share with your family, great. If you're willing to share them, then we will post them and take a big kind of group picture of our drawings as well. You can just leave them on the table.
You don't have to, no pressure. You do not get prompted.
I don't know if this one is working. Is this working? I actually don't know. We have 3 minutes. 3 minutes before the drum circle begins.
Got it, 3 minutes.
Okay? So I'm mentioning this. If you desire to be on time at the drum circle, feel free to leave. What we'll be talking here in the next couple of minutes are the outcomes. And you could imagine that we have something to share about outcomes, meaning that this, what you just engaged, produces some meaningful things. Joint Commission for Accreditation of Hospitals has indicated that those modalities, non-pharmacological, should be the first intervention. And so, what I wanted to share with you, how you can incorporate mindfulness in acupuncture and massage and yoga in one group visit. And that is the work that was done in the Cleveland Clinic. We published this last year. We had about 170, 80 patients. So at every visit, what patients engaged into, they work like this. You just picture, actually, Dr. Godaka showed a picture from Cleveland Clinic. If you notice, there was a group of receiving acupuncture in a circle. So you would be in a comfortable chair. You would get the needles, or little pellets in your ear. There would be holistic mind-body specialist walking around and guiding you through guided meditation or light hypnotherapy. And at the same visit, after this, you would get some instructions about self-massage and do some yoga stretches. That was the group intervention. Yeah? So clearly what you just experienced was a little bit different than doing those treatments. And so here is what I just copied the picture here. You don't need to look at the numbers or anything like this. The whole point here is that when you give the question to the patients at the beginning, and then you repeat this 8 weeks later, so they were coming for 8 sessions, once a week for 3 hours. So the visit was 3 hours long. Yeah? What you can experience, what they reported to us, their physical function was improved. Their anxieties decreased significantly, both clinically and statistically. Depression, fatigue, sleep disturbance was lower. Yeah? Ability to participate in social roles, pain interference, and pain intensity. Everything what was measured was significantly reduced. It didn't make a big difference whether those patients were receiving opioids or didn't receive opioids. We had those 2 groups. When we looked at the use of opioid medication, nothing was statistically significant because we had enormous variability. Some patients decreased about 120 morphine milligram equivalents, some had to increase within that group, so you don't have statistical power. But there were on average about 57 morphine milligram equivalents less medication use. So what we can for sure say is that participating in those group visits, you improve dramatically physical function, mental, social well-being, without increasing the pain medication use. Yeah? So quite powerful. And Tiffany will switch to show you what this kind of intervention can result in. Yeah, so there are many different ways to do this. Yeah, and
I think I'm not going to take extra time on this other than to say that we have done local data looking at some of these same, or local studies looking at some of these same outcomes. For our pain groups in particular, you can see bad things going down, good things going up. In particular, patient-reported enjoyment of life, patient activation, and their use of the integrative modalities goes up significantly over the course of, this was a 6-month intervention, once a month group visits. We also have done the same type of work in the diabetes and weight management space, looking at cardiovascular risk factors. Not only are there improvements in multiple domains over the course of the 4-month period, but also there's a dose-response effect. So the more frequent, or the more of the group visits that the patients attended, the more improvement that they had. And as opposed to, say, a medication for blood pressure, where you might improve your blood pressure, when you do lifestyle interventions, as we know, you get improvement in a variety of different domains. So finally, just thank you for being with us. I hope that if you have not tried group medical visits, that you consider trying them and also recommending them to others for the reasons that we discussed today. And patients are amazing program partners. So if you or any of your friends or colleagues have ideas for us, we would love to hear them. Thanks so much for your time today. We appreciate it.